We're discussing the temporalis muscle. We're having a look now at the treatment of trigger points that arise from this muscle. The trigger points, as you remember, were very fascinating, referring up into the scalp and right down into the top teeth of so mimicking toothache. The anatomy is that I've drawn here is the mandible, there is the top of the mandible joining into the temporal bone, forming the temporomandibular joint. This is the coronoid process of the mandible. Running across here is your cheekbone, and this is called your zygomatic arch, which is an actual arch of bone, and the temporalis tucks underneath that arch of bone and attaches into the coronoid process. It's a big, strong tendon, which then fans out, becomes muscle at about this point, and attaches in a broad band into the temporal bone. The muscle is superficial, but it's and it's broad, but it's quite a bulky muscle because its job is to, when it contracts, is to close the jaw, and it's part of your biting mechanism. So it's quite a strong muscle. And if you were to clench your teeth, you would feel this muscle bunch up. So the trigger points in this muscle, well, there are 4 trigger points, and I can't draw them, I'm afraid. There are 4 trigger points. The first is there, and the way you find the muscle is when you clench your teeth, okay, and I can feel the muscle bulges up. It starts here and it runs across to there. Thank you, just relax. And the triggers occur in the maximal thickness of the muscle, which is where it tends to bunch up. So the first is there, and this will refer up this way and down to the top front teeth. The second trigger is further back in the front. The second is just behind it. The third is just here, and the fourth is there. If you remember, the front 3 referred upwards and down to the teeth, and the back one just referred into the back of your head on the side here.